Insurance system, I think he probably does. We're in no doubt. The NHS needs reform.
How was this obnoxious Reform UK MP part-time patriot Richard Tice been easily exposed over the NHS? Not just Tice, but also Farage as well. Yes, I know every lefty's favourite Labour minister was Streeting. Not. I get it. But Streeting was taking questions about the government's 10-year plan for the NHS when little Dick Lice asked this question.
There's much that unites us, I think, in this House about much of the excellence in this 10-year plan, Secretary of State. In particular, the NHS needs reform. In particular, that, of course, healthcare should always be free at the point of delivery. But what brilliant frontline staff and doctors and nurses say to me, Secretary of State, is that it's the bureaucracy, it's the unnecessary processes and procedures, and also with regard to social care. So can the Secretary of State reassure this House that the senior management of the NHS are absolutely determined to reduce this bureaucracy, in particular around technology and the delays caused by GDPR?
Mr. Deputy Speaker, I can say the NHS leadership are absolutely determined to work with us to reduce waste, inefficiency and bureaucracy. We have in Sir Jim Mackey an outstanding Chief Executive of the NHS, and he and his team are working very closely with ministers to make sure that we achieve that goal. As for the funding model, from one day of the week to the next, I just don't know where the Reform Party stands. I heard the leader of his party on the radio this morning doing the dance of the seven veils. For someone who's normally very good at being a straight-talking politician, as he likes to present himself, I can't follow quite what the Honourable Member for Clacton thinks about this issue. Does he support a taxpayer-funded universal NHS free at the point of use? No, I don't think he does. Does he support, the only European thing he has ever supported, by the way, the European-style insurance system? I think he probably does. We're in no doubt. The NHS needs reform, but it needs the Reform Party like a hole in the head.
Now, I must admit, not a fan of Streeting, but I do agree with him when he said that the NHS needs reform like a hole in the head. Also, when a libertarian speaks about cutting bureaucracy, I kind of get rather worried, because what does he mean by that? Granted, he only has a certain amount of time to ask his question and can I read, the full speech or chapter of War and Peace, but I do get worried when reforms speak about bureaucracy. Also, when little Dick Lice speaks about the NHS being free at the point of service, do you believe him? Given that his leader wants an American insurance-based style model for healthcare, do you think our part-time patriot Little Dick Lice really wants an NHS free at the point of use? I don't. But what do you guys think? Let me know down below. Have a fantastic weekend, and also be careful with the sun, protect yourself, and hopefully see you Monday.